Hi, everyone. Today, I wanted to discuss the results from my genetic screening. I have had the results for a little bit now, but I just had an opportunity to talk with a genetic counselor with the actual company that did the testing. Prior to this conversation, I received the results from the genetic counselor through the hospital system that I'm receiving my treatment through. And so she contacted me to let me know that my results were in and that they were negative. And she sounded so happy when she came to deliver the information. And I think my tone on the voice was kind of like, I was definitely kind of dry and not as excited as she was, because I think I was ready to hear that I had this mutation, because then that would be the reason why this is happening to me. Because anyone that has a diagnosis like this, I'm sure has gone through the same thoughts in terms of, well, why did this happen? What did I do wrong? What could I have done different? Whatever the case may be, to change the outcome of the situation. And so having a genetic mutation would ultimately, be an answer in terms of why this happened. And so for her to call and say that it was negative, I was just kind of like, okay. And so she could sense the tone. And so she was able to kind of brighten up the conversation by saying, well, this is a good thing, because that means that, this isn't something that you have to worry about passing on to your children. And so she's right about that. That's definitely a good thing and a great way to look at it. Although it still doesn't give me the answer that I was looking for. And who knows if I'll ever get the answer that I'm looking for. But, I was kind of expecting that. And so I didn't get it. And she told me that I can go in there and look at the full report. And I didn't, because I was really bummed about the results. However, since then, now that I've taken the time, I have gone into the portal, downloaded the results, and taken a look at them myself. And I've also had an opportunity, like I said, to speak with the genetic counselor that's through the, that's associated with the company that did the testing. Invitae, I guess is how you pronounce it. Invitae diagnostic testing results is what I have. And so talk about what I had done. I had a 84 gene panel that was done to check for any genetic variants or genetic changes through those 84 genes that they currently are able to test for. And so out of all the 84 that they currently are able to test for, I was negative for all of them. So yay. I can definitely laugh about it now, because I do have a better perspective about it. In terms of the conversation with the genetic counselor through the company, again, she went into saying how there was no genetic mutation present in the panel. And so what that means is, out of everything that they have so far, there's nothing, there is a mutation in terms of cancer, because that's what cancer cells are. There are mutations, but there's not a mutation because I got bad genes from, one of my parents. It's a mutation either from environmental or, some other trigger that they don't really know why it causes that to happen as of now, as of yet. In terms of what I need to do next with the results, because there is still a strong history of cancer in my family, the recommendation is that I, with my mom having melanoma, that I see a dermatologist, which I told her I've already been seeing a dermatologist for at least the last 5 years now, 5 or 6 years. I see a dermatologist every year and have a full body scan. So check mark there in that box. That's already being done. Outside of that, there aren't any other recommendations. There isn't anything else that I need to be doing that's different outside of normal cancer screening recommendations, because again, the genetics was negative. She said if they had been positive, then maybe there will be a conversation about, speaking to someone about my ovaries, because, a lot of the mutations that cause breast cancer they are also linked to ovarian cancer. And so with them being negative, then, there's no real concern for a high risk of developing ovarian cancer because it's negative. I asked her, she went into talking about the children again, as well as like what the other counselor said, that because they're negative, there's no need to be worried about the children. There's no need for me to be concerned that I could be passing on, bad genes to them as well. However, with me having a daughter and having a cancer diagnosis at such a young age, Matea will still need to be screened early for, for routine breast exams. And so she said that they look at it as of right now. The evidence is that, if you had a parent that was diagnosed, a mom that was diagnosed at an early age, you need to start about 10 years sooner with your testing, with your screening. And so what that means for Matea is that she'll start, getting mammograms in her 20s. So around 27 would be the recommendation. Ultimately, with, me being her mom, I'm going to recommend that she get it as early as possible. So if it can happen before 27, I'm going to be pushing for that as well, because, I understand the importance of early screening. And, just in general, being proactive in your healthcare. So definitely going to push for her to be aware of that and make sure that she's getting the screenings that can save her life. And so, so the positives with all of that is that there is no high risk of developing other cancers. So that's the positive of having the negative results. There's, I'm not at high risk of developing other cancers because of these genetic mutations. So that's the plus. Like I said, it doesn't answer the question in terms of why, but at least, I know that there aren't funky genes out there that are in my system that could lead to something else. Question that I asked her, one of the questions I asked her was, in the event, because like there are 84 genes that they have now, but we know that medicine continues to evolve, science continues to evolve. And so with science evolving and they discover more genes, would I have the opportunity to be a part of future tests to identify if there are any mutations? And so she said, yes, absolutely. So because I'm already in the portal, more than likely I will receive an email if there are additional tests that come up, additional genes that are identified that maybe I could benefit from having tests done. Another way of communication would be from the provider in terms of him, they may order it to, see if any other new genes, if there are new genes at the time, if I'm affected by any mutations with those genes. The other question I have for her is false negative. Are there any situations where they receive a false negative? And so she said, usually no. They're extremely rare. And so she said, genetics don't change. However, the interpretation of genetics could change in the future. And so right now they're extremely conservative. And so that's why she said it's very rare that there would be anything new that they would look at in the current panel that they tested on me, because they already take their time to look at those current patterns. And so, even if there's like a small like change, they're able to identify that. And so, on the extreme microscopic level that they look at it, they were like, mine absolutely had no mutation present, no sign of a mutation present, like absolutely like far from it. But she said, again, like how they interpret it as science continue to evolve, like maybe they may look at it with, for lack of better terms, with an even finer tooth comb. They're already looking at it with a fine tooth comb. And so as things evolve, maybe there's an even finer tooth comb that they can look at these genes, and maybe, they discover something. And if they do, they'll contact me. But just in terms of where they are now, the information they have now, the tools that they have now, my negative is definitely a negative, basically is what she said. And so that's that. Again, I have had time to process it. And so I agree, negative is definitely a good news. And I am thankful for the negative result. It's just that when you're in that, that flesh moment and you want answers, you kind of get in your own head and be like, well, why did this happen if it's negative? What is this about? But everything happens for a reason in its own season. And so, I'm going through this in this season for some reason. And I don't know, when I'll actually know, because I know that it will be confirmed, because most things are confirmed to me. Anytime I'm questioning God about, why I'm going through something in life, I usually always get the answers that, I need. And so I know that those answers will come. It's just a matter of, of time. And so when they come, I'll share what my prophecy is, or what my interpretation is. But until then, this is where we are. So I just wanted to share that with you guys. I recommend genetic testing. I know I've said that before, so please get it done, guys. If you are, diagnosed, it doesn't matter if you're diagnosed at a young age or even, older, definitely still get the genetic testing done when offered, because it's good information to have, not just for yourself, but for, your children and the future generations. And so get it done. Have someone go through the results with you to make sure you understand them, and, go from there. So thank you, guys. My little one has walked in. She got the door open. There's some background noise. So thank y'all. Like, comment, share, and subscribe.